The loss of voluntary movements or in any part of the body like limbs due to the injury to the brain or spinal cord, or maybe because of brain tumors. Causes include stroke, which is the most common cause for paralysis, or spinal cord injury, multiple sclerosis, multiple brain tumors or brain injury, or infections like polio or meningitis, or nerve damage. These cause the loss of nerve supply to the muscle, and there will be loss of voluntary movements. Symptoms include inability to move their limbs, loss of sensation, muscles weakness or flaccidity, or loss of bladder or bowel control, muscle stiffness or spasticity, difficulty in speaking or swallowing. This will be the signs and symptoms of paralysis. Now coming for the diagnostic test. Diagnostic test includes neurological examination, like examination of the cranial nerves, and then CT scan or MRI scan of a brain or spinal cord to see any injury. Then EMG or nerve conduction studies to be done, and blood test is required to know the cause. If it is because of any infection, there will be elevated WBCs in blood test. And then coming for the types of paralysis, it may be monoplegia where one limb is involved. It may be hemiplegia where one side of the body, that is ipsilateral side, is involved, or paraplegia where both lower limbs or upper limbs are involved, quadriplegia, that is, or tetraplegia where all four limbs are involved, or it may be Bell's palsy due to the injury to the facial nerve, which is the seventh cranial nerve. And management includes, it may be a medical management, which includes to treat the underlying cause. If it's an infection, we'll give antibiotics, and see for the medications like corticosteroids or antiviral or antispasmodics are being given. And coming for rehabilitation, physiotherapy is recommended to improve the strength and mobility. Then we see for occupational therapy and speech therapy if it is needed, and use of assistive devices as they can't move their limbs voluntarily. We can use some assistive devices. This is all about the paralysis. We learned definition, types, causes, management, and diagnostic. If you find this video helpful, please do like, share, subscribe to my channel. If you have any suggestions, let me know in the comment section. Thank you.